What's going on, YouTubers? I wanted to tell you guys about Secretary of Health and Human Services Kathleen Sebelius proposed that medical records of all Americans be turned over to the federal government by private health insurers. This was reported in the WashingtonExaminer.com. That's the WashingtonExaminer.com. It reads that it's been said 1,000 times Congress had to pass President Obama's health care law in order to find out what's in it. But despite the repetitiveness, the level of shock from each new discovery never seems to recede. This time, America is learning about the federal government's plan to collect and aggregate confidential patient records for every one of us. And a proposed rule from Secretary Kathleen Sebelius and the Department of Health and Human Services, HHS, the federal government is demanding insurance companies submit detailed health care information about their patients. The HHS has proposed the federal government pursue one of three paths to obtain the sensitive information: a centralized approach wherein insurers' data go directly to Washington, an intermediate state approach in which insurers give the information to the 50 states, or a distributed approach in which health insurance companies crunch the numbers according to federal bureaucrat ethic. It's par for the course with the federal government, but abstract terms are used to distract from the real objective of this idea. No matter which option is chosen, government bureaucrats will have access to the health records of every American, including you. There are major problems with any one of these three options. First is the obvious breach of patient confidentiality. The federal government does not exactly have a stellar track record when it comes to managing private information about its citizens. Why should we trust that the federal government will somehow keep all patient records confidential? In one case, a government employee's laptop containing information about 26.5 million veterans and their spouses was stolen from the employee's home. There's also the HHS contractor who lost a laptop containing medical information about nearly 50,000 Medicare beneficiaries. And we cannot forget when the USDA's computer system was compromised and information and photos of 26,000 employees, contractors, and retirees potentially accessed.
The second concern is the government compulsion to seize details about private business practices. Certainly many health insurance companies defended and advocated for the president's healthcare law, but they likely did not know this was part of the bargain.
Currently, the healthcare providers are being asked to provide proprietary information to governments for purpose that will undermine their competitiveness. Obama and Sebelius made such a big deal about Americans being able to keep the coverage they have under Obamacare. With these provisions, such private insurance may cease to exist if insurers are required to divulge their business models. Certain businesses have lost confidential data like the federal government has, but the power of the market can punish the private sector. A victim can fire a health insurance company. He cannot fire a bureaucrat. The ability of the federal government to spy on, review, and approve individuals' private patient-doctor interactions is an excessive power grab. Like other discoveries that have occurred since the law's passage, this one leaves us scratching our heads as to the necessity not just of this provision, but the entire law. The HHS attempts to justify its purpose on the grounds that it has to be able to compare performance. No matter what the explanation is, however, this type of data collection is an egregious violation of patient-doctor confidentiality and business privacy. It's like J. Edgar Hoover in a lab coat. And no matter what assurances Obama, Sebelius, unelected and unaccountable HHS bureaucrats make about predictions and safeguards of data, too many people already know what can result when their confidential information gets into the wrong hands, either intentionally or unintentionally.
Thanks for watching my video. Peace.